Hello, I am Dr. Soni. I am a plastic surgeon, Director of Medispa Laser Cosmetic Surgery Center. Today I would like to discuss about hair fall, causes of hair fall, transplant, their procedure, types, advantages and disadvantages.
As we see routinely, the hair fall either starts from front and its hairline recedes to back, or the vertex area starts emptying and the top areas goes. In even 90s, this back area never ever goes. We can see the hair which are remnant for life is the back strip which remains for life almost. Generally we wonder why the hair fall is only from top and never from back side. The reasons which generally people think of, some deficiency in the front skin, like maybe iron deficiency, multivitamin deficiency, maybe sensation loss, maybe some nutrition loss, maybe due to dandruff or cap or stress, helmet or water change or environment change. But none of these conditions are responsible for these type of hair fall. Actually the skin in front and back is almost the same. There is no difference at all. We have almost different type of hair in different part of body. For example, eyebrow hair have different quality, they never ever grows. Eyelashes not even a millimeter. Beard, mustache, they grow faster, thicker caliber. Chest and hand hairs are thinner, they are curly and have a limited length. So we can understand that the different quality of hair in different part of body, and altogether skin is same everywhere. We can compare it as a field. Like in a field we have the same soil but different type of plants growing there. The different growth is due to their different genetic makeup or genetic characteristic features. Similarly, the hair have different characteristic features in different part of body. For example, the frontal hair or the top hair are DHT sensitive. DHT, dihydrotestosterone, is the another name of androgen hormone. As we know, androgen hormone is normally present in all human and it increases as we grow up. As the DHT hormone level increases, the hair which are sensitive for this hormone, for example, we consider this white as a receptor for DHT hormone. When the hair which is carrying this DHT hormone receptor will sense the DHT hormone and they start thinning. So only the sensitive hair got thinned out first or later. These type of sensitive hair are present in frontal areas. So more sensitive hair fall early in life, less sensitive hair fall later in life. These back hairs are insensitive, that's why they never ever fall. So DHT sensitivity is the reason of this pattern hair loss. That's why this is also known as androgenic alopecia. And because this DHT or androgen sensitivity is carried in our genes, it is known as genetic hair fall. So if there is pattern of hair fall is bifrontal or vertex, it indicates it's a genetic hair fall. It may be carried from a paternal or maternal side, maybe from father, uncle, great grandfather or grandfather, or maybe maternal side. So it can be from mother or father side families both. It's not necessary that all four brothers will have similar hair fall pattern. There are variations and there can be skip patterns. For example, all parents are healthy with normal hair but the child have some hair fall problem. So it may be inherited from fathers or great grandfathers. So basically we have to understand if there is a pattern hair loss, it indicates it's a genetic pattern. Some other diseases have different type of hair fall pattern. So the treatment which we are discussing is for genetic hair fall, which generally progress from bifrontal region or temporal vertex region and progresses slowly in the top area, and these back hairs never ever goes. Ideally speaking, DHT sensitivity can be reduced by some medicines like minoxidil and finasteride, so that the hair fall will be reduced, hair thinning pattern will be reduced. Temporarily thinner hair can be thickened by these medicines, but the effect will be lasting only till the medicines are used, which is this type of treatment is comparable to treatment of diabetes or hypertension. So we have to take longer duration of treatment for reducing hair fall. So if we have this grade of baldness like grade 1, 2 or 3 or 4 in which the hair is falling, we can utilize some medicines to reduce hair fall. But these medicines has to be continued for longer duration to maintain hair fall reduction.
Ultimately, if you leave the medicines, there are high chances the hair fall restarts and may progress.
The areas where the hair is already fallen off from the roots, like this, the hair is thinning and the root is gone,
then the medicines will be useless. There is no effect of medicine in these type of areas.
For example, in grade 7, when the area is totally bald, medicines will not be useful. Similarly, in grade 6, 5, 4, 3 or 2, where the areas are empty or the density is low.
So no new hair grows with any type of medicines. There is nothing in the world which helps except transplant to regrow new hair.
So simple logic that if there is no hair root,
nothing can regrow a root except we have to plant some hair root in that area. So hair transplant is like normal body organ transplant, as we heard of hair like heart transplant, lung transplant, liver transplant, kidney transplant. So these are body organs which can be transplanted from one area to another in same body or another body. So similarly, we transplant hair root from one area of body to another.
So there are two different important points when we consider a hair transplant. One, when we shift a hair root from one part of body to another,
the quality should match. For example, if you want a scalp quality hair, we should take most probably the back hair scalp quality. They have a similar scalp quality, they grow for long and maybe lifelong without any maintenance. If we try to extract other part of body hair like mustache, beard or chest, they will have different characteristic property, they will not look natural. So the ideal donor area is the back of the scalp where the hair grows for lifelong.
These back hairs we take as a root. For example, if you see this area, this is a skin piece which is visible under 20x magnification. Same when seen by naked eye is like this is 5x magnification, this is 10x. So in magnification we can see the hair clearly, we can see the judge the direction, like you see there is thin hair of different direction, this is different direction, this is, so I can visualize and see the direction of hair, plus while division I can preserve the hair roots without damaging, I can divide because I am seeing under magnification.
So as a plastic surgeon, as a hair transplant surgeon, my responsibility is when I extract hair from back and shift to front, hair damage should be minimal during shifting, the root should not be damaged. So at my center Medispa, I take it very precisely that I should not damage more than 1% of hair. This is the specialty of Medispa. The damage rate is reduced
by the use of magnification system. I have German microscopes,
not 1 or 2, 15, which uses around 20x magnification,
plus
team of helpers or the assistants which are trained from last 7-8 years to do the same job. Assistant have a experience of 7 to 8 years of cutting more than 1 million hair per assistant.
That's why I can reduce the damage rate to less than 1%.
Because if I damage more, there are twofold disadvantage. One is when I transplant in a given area 100 hairs, if the damage is high, the density which will come out will be less. Secondly, I will lose the permanent hair permanently for the life. So I have to reduce the damage rate, which I can achieve up to less than 1%. So I am sure if I am planting 100 hair by count, I am sure 95 will at least regrow.
When I transplant a hair,
I have to take precaution of naturality of the hair design, because hair transplant is a combination of science and arts. When we shift a hair and it regrows, that's a science, but if the regrowth looks natural, it's an art.
Now while plantation, I take precaution how I plant the hair.
Every plantation is done by manual work. Even a robotic transplant is extraction only, not implantation. So implantation is always manual by hand work. So it depends on the artistic knowledge of the surgeon and experience, how artistically he can transplant the hair.
At my center, what precautions or what special things I take care? One is the directioning. You can see this patient has been transplanted by me, and I have taken utmost precaution to make the direction as
same as the previous hair. If the direction is not proper, they may entangle and look bad.
Second thing is density. If I take these two areas, I make sure the skin should not be visible, the density should be very high.
How high?
How much high? I try to do it around
75 follicle units per square centimeter. This is the highest which I can achieve. Even if I achieve 60 follicular units, which is routine in my cases, skin is not visible. Rose plantation is a difficult thing because it requires high technical skills and experience. Because I am a cosmetic surgeon, I do a lot of microsurgical work, so I can plant this hair as dense as 60 to 75 follicular units per square centimeter. On an average, most of the hair transplant centers do this maybe around 30 to 40 follicular units. The density is less at other centers compared to Medispa.
Third and the most important point is hairline design. This front hairline is very important
To give a natural look to the patient. This hairline changes according to the age of the patient, according to the occupation, according to the gender of the patient.
For example, this is a young patient around 22 years old. I have transplanted a small area with a high density transplant with proper angulation and hairline according to his age.
That's why he is looking natural and no artificial looks.
I have transplanted a patient with 55 years of age. If you can judge that this area is transplanted and is looking natural because of the design, because of proper angulation of hair, because of proper hairline design. Actually, hairline, frontal hairline is an art. It's not a straight line, it's an irregular line of single hair with a proper angulation. That's what I make, single hair in the front with irregular margins and proper angulation, plus a high density frontal area so skin is not visible. Another example is 70 years old male being transplanted by me. Again you can see it's looking natural. If I had started hair transplant in this patient from this frontal area, it would look bad. So I have to take precaution according to the age, hairline design according to the age. Again a younger patient, its design looks very natural, the hairline looks very natural, the density is good. A very young patient, you can see the change in photographs, maybe around 20 years of difference between two photographs. That too it's looking natural, no artificial looks. Why I am talking about naturality again and again? Because I see a lot of results like this, in which the hairline is not proper, the directioning of hair is not proper, the damage rate is high and coverage is poor. So this is a disaster with the patient because he expects a lot with the transplant and came out with this type of results. The reason behind that surgeon might not be well experienced, he might not be a plastic surgeon, he might not be a hair transplant expert, he might not be thorough with the angulation, direction of the pattern of the hairline design. So there are a lot of reasons of these type of failures. We take precaution at every steps. We take precaution to give proper hairline design and density, as well as a painless treatment. We have a special management of pain so that patient doesn't feel any type of pain during the procedure. During the procedure he takes his normal lunch and breakfast and tea break, and in the evening the procedure is finished and he can walk to his home. From next day morning he can start his routine job with a cap on. He can shampoo with a normal shampoo and water from very next day. So stitches which I give on the back side are absorbable, no need to remove, and waterproof. From very next day we can shampoo with normal water. There is a specialized technique to harvest the hair from the back side that is known as a trichophytic closure technique. The advantage of this harvest technique is there is no scar which is left behind in the scalp. How does it work? When I take the hair out from the back side, I close the area, stitch it properly, and in the final line I leave some hair root intact. So in the final line also the hair grows up and the line is not visible in future. This technique is known as trichophytic closure, and I am doing this technique since last 4 years and it works very well. There is no scar visible, as you can see in this example, blue shirt, back side, nothing visible in the scars, even with combing nothing is visible. This is an example of the same patient being transplanted in the frontal area. So you can check lot of examples with natural hairline design, a dense hair pattern, a very natural design according to the face, according to the occupation, like he is a doctor, he is a gentle hairline design. An artist requires a
exaggerated hairline design,
a denser and natural look. So there are a lot of examples of these kind of baldness in which we have done transplants and given a satisfactory results. Even a smaller area will give a great change in the facial outcome, a younger look and a natural look. A bigger area also looks natural and denser. So our specialty is to give a natural hairline design, high density transplant and bigger areas of transplant. So you can see a lot of patients being transplanted with higher grade of baldness, bigger areas, and all look natural according to their face and age. So these transplants are looking natural because of the design and the pattern. There is another method to extract the hair out is FUE, follicular unit extraction technique, which is now being very popular. Popularity are due to many reasons, I will explain later. The procedure is such in which we take a hair out by a drill, but the problem is we can't make out the direction inside, so we have to make a guess. We have to make multiple holes in the scalps. Each holes contain a graft, but we have to leave an intact graft in between. So the total extraction is less compared to a strip method in which we harvest in continuity. The damage rate is high in FUE because it's a blind technique. I will show some videos. There are chances of extraction from unsafe areas like this nape of the neck and the vertex, which will lead to early loss of hair because these have less life. It's not a scarless procedure. Every FUE will leave a white dot when we take out the hair out. So there is nothing like scarless. The total density is reduced, so the next sitting becomes difficult. The damage rate is high because when we take the hair out with the drill, we are not sure below this direction what is the direction of hair. So if we miss by 5 degrees, we traumatize the root. Especially in double hair grafts, when we try to cater one hair, we are likely to damage the second hair. Skin is a dynamic structure, so when we push the skin, there is change in the hair curvature. That is also a cause of hair damage. Especially in curly hair, it is difficult to extract without damage, or the damage rate will be very high because drill goes straight. So if you do a FUE in these type of patient in which there is a greater degree of baldness, the total extraction is less, the coverage is low, and if the artistry is not proper, it looks very artificial. So FUE is not a good option for higher grade of baldness when we require higher number of grafts. Ideally speaking, small areas which have good donor area with small area requirement up to 2000 grafts is the ideal candidate for FUE. But in patients, if we do a higher grade of baldness with FUE, this is the result. The coverage is not proper. Again, a FUE case with an improper architecturally designed hairline and density is poor. Again, a FUE case with very irregularly designed hairline, bad results. I want to discuss a case in which this patient has undergone hair transplant twice, one with FUE, one with FUT. But still patient is unhappy because of the design and pattern. It's look bushy and very unnatural. So ultimately it's the design which is important, it's the implantation which is the important role in hair transplant results. It's not just the extraction. So when we see internet and talk commercially about transplant, they talk about the procedure that we do FUT or we do FUE, we do latest techniques, scarless, painless, stitchless, but nobody talks about the designing of implantation, which is equally, or I feel, more important than extraction. So what happens with these type of patients? Because of the improper directioning, they looks very odd. Because of unartistic distribution, looks odd. So when these type of patients comes to me, I have to do a strip hair transplant and extract all the hair from unnatural sites like these. I have extracted all the hair back which were unnaturally placed in unnatural directions and implanted it back again
in proper areas, proper directions. Now this patient is looking like this. So same hair transplanted in proper direction position looks better. So what we should look of is a doctor who can do it more artistically. This was the patient who was done by me last year, a young boy with higher grade of baldness, and is now very happy. But obvious, because he was not married before, he got married after the surgery. This area is looking dense, he is looking very natural. Again, bigger area was transplanted because I do a strip method. And you see the naturality of the design. I have transplanted this frontal area as well as small temporal triangle, which gives a very natural and artistic appearance. So implantation is very important to do in proper directioning position to give a very natural look. You can see the closer look of this patient. So hairline design is an art, it's not a straight line, it's an irregular line. There is single hair in front, double and triple on back side. Again, there is a proper angulation with the scalp. And with trichophytic closure, no scars visible. You can see the video of this patient because videos are actual testimonial of the results. There is no Photoshop. So you can see actual hair growth in proper directions, actual density. Another patient with lower grade of baldness, I have designed this hairline like this. This was intra picture. This was 10 months post-op. So in 10 months you can see this hairline looks natural and dense. And if you see the videos, you can make out this is a transplant or a natural thing. So again, the hair transplant is an art, it's not just the science. So implantation is an art, it should be done in a proper method to give a natural look. And a trichophytic closure, even with a strip method, with a buzz cut hair, no scars visible. So negligible scars. So need not to worry about the scars in a strip method if a surgeon is trained and giving good result in trichophytic closure method. In fact, even minor scars are never ever bothering. And nothing is scarless. Even in the FUE, they will leave a multiple dotted scars. But what we are seeing for is a good result with a high number of grafts, which is possible in a strip method. Less damage rate because may require second sitting or third sitting, which is very much possible in a strip method, not in FUE. And a constantly good results, which means a denser look and a natural design. So at our center we have done more than 2000 successful cases. Most of the clients are now from outside India, coming from abroad. They are coming for just a day treatment. They live here for 2 or 3 days and they fly back to their country. No much follow-up requires. You can do daily head wash from very next day. We have to wear a cap for 7 to 10 days, but because it looks odd, 5 to 7 days antibiotics. That's all. These transplanted hair falls off once and start growing after 3rd month, and full growth is around 10 to 12 months. So no frequent follow-ups, no special precautions, no special medicines, and they grow for life. You can normally shampoo, comb, cut, dye, whatever you want to do. Wear a helmet, swimming, gymming, exercise, even you can shave it off, they will come back. Best part is no side effects at our centers, no scars.